A very warm welcome to all the participants, faculty members, students, and research scholars from various institutes. A warm welcome to the webinar on stress and brain health. First of all, I would like to welcome our beloved principal, Reverend Dr. Praveen Martis SG, and our speaker for our today's webinar, Dr. Madhu Ellen. A very warm welcome to you. In these present days, stress is something which we all go through at times, and in these pandemic times, it is something which we all need to be aware of. So, our speaker is going to talk something related to this. Before we begin, I request our principal, Reverend Dr. Praveen Martis SC, to address the participants and inaugurate the webinar. Over to you, Father.
Yes. Good morning to all of you. I'm very glad to inaugurate the international webinar on stress and brain health. This is a very important topic that is chosen by the Department of Biochemistry in the times of pandemic. I think this is a very good message that we all get, that how to really cope up with the stress and the brain health during these important and difficult times. St. Aloysius College is a 140-year-old premier higher learning institution situated in Bangalore, which is an autonomous college. The college has a lot of departments, and we have been organizing number of webinars, and many of you have been taking part in all these webinars and supporting our venture. At the same time, the learning process is continued throughout. I'm glad that you all have joined for this purpose. I'm very happy to connect with our resource person, Dr. Madhu, LN PhD, postdoctoral research associate. Madhu is not new to Bangalore St. Aloysius College. She's our former faculty, a well-known faculty. All the students enjoyed his classes. Now he is in US doing his postdoctoral studies and has readily agreed to give a talk on stress and brain health. I'm sure you'll all enjoy this session very much. So I thank Dr. Madhu for accepting our invitation and continue to be part of St. Aloysius College. Thank you very much. I'd also like to congratulate the Department of Biochemistry, Dr. Yogi Somayaji and Dr. Swarnalata for organizing this seminar, the webinar on stress and brain health. This is the time of getting stressed. I request all of you to engage yourself in this webinar, learn from this webinar so that we can together take the society forward. The humanity should thrive in the time of pandemic. I'm sure all of us will be able to come out of stress that we are struggling, and you all know the ill effects of the stress and how we can live happily and peacefully. Once again, I invite all of you to engage in this webinar and wish you all the best. God bless you. Thank you.
Thank you, Father. I will just give a brief introduction about our speaker today. Speaker for this webinar has done extensive research in the field of neurosciences, Dr. Madhu Ellen. So Dr. Madhu Ellen graduated from St. Aloysius College in 2007. He completed in Masters in Biotechnology from Bangalore University in 2009. And he worked as a junior research fellow and senior research fellow for BRNS project sanctioned to Professor Sucheta Kumari, and under whom he completed his PhD in 2014. He worked as assistant professor in the Department of PG Studies and Research in Biochemistry, St. Aloysius College for 5 years. And currently is working as postdoctoral research associate in the Department of Cellular and Regenerative Medicine, Texas A&M University. So he's working on neurodegenerative diseases caused in Gulf War sicknesses, and he has numerous publications related to uh, neurosciences and many other aspects of neuroscience and stress physiology. Over to you, Dr. Madhu.
Good morning, everyone. Okay. So I'll be talking on this particular topic, the stress and brain health. So first of all, I would like to thank for the principal and also uh, Dr. Yogish and Dr. Sarnalta for providing me this platform to talk about the stress and brain health. So why did I choose this particular topic? Because some of my research, which is very much relevant to the field of stress and the neurodegenerative diseases, which is associated with that. So when we talk about the stress, so there are different aspects are there in the stress. So before I start with my slides, so I just want to give a brief idea of what exactly I'm going to talk about the topic. So I won't be giving any solutions to the stress exactly what the different kinds of stress what you will be facing in your day-to-day life. But so I'll be talking more about the neuroscience part and the biochemical changes, what exactly happens in the nervous system and in the brain, and what are the different types of neurodegenerative diseases, which is or neurodegenerative or neurological disorders which is associated with the stress. So that information I'll be giving, and also I'll be ending up the topic with some information about how we can relieve the stress or we can reduce the stress exactly, the chemical biochemical changes which is happening in the brain, so how we can control that during the stress condition. So that will be the flow of my talk. So I'm working this on this particular topic mainly in one of my study, that is a Gulf War illness, as Dr. Yogish mentioned now. So one aspect in that Gulf War illness is it is also induced by the stress. So the veterans, those who are suffering with the Gulf War illness, they also have the different kinds of symptoms, which is it's very much relevant to the post-traumatic stress disorder. So those aspects I can connect to the talk what I'll be giving. So what is stress according to you? So the stress can be different for different persons. So whatever I feel as a stress, it may not be stress for the other person. So vice versa. So it depends. So I have just pointed out some of the stress what you can end up having in your lifetime, like some of the major life-changing events, what is happening in your life. You may be losing the job or failing in the exams or some kind of changes what the major changes what happens in your lifetime. Maybe it is a chronic illnesses what you'll be facing, or the mild kind of the mild stress, you can call it, as like when you're working with your colleagues, or when you're in the school or in the college, when you're interacting with your friends or friend circle. So what happens is somehow you'll end up having some kind of small stresses when you interact. You'll get some kind of bad opinions, so you'll keep on thinking about that, and such kind of things will make it as an acute stress. And if it extends more and more, then it becomes a chronic stress. So those are the some kind of small stress, or the mild kind of stress what you'll be facing in your day-to-day life. Or it can be relationship difficulties among the family or among the friend circle, or it can be financial problem. Financial problem, it varies from person to person, because some people they will be happy with whatever the money what they have, and some people, even if they have crores of money, they won't be happy. So the stress level, it matters. So how you consider it, so that's what the level of stress will be measured. So, and also being busy in your life, from the morning till evening, you'll be keep on working, or you'll be interacting with something, or so there won't be a proper time for the sleep. There won't be a proper time for the having the food. So such kind of busy schedules some people are having. So that can also end up having the stress. And again, the family issues, the taking care of the childrens or taking care of the elders in the family. So some people, they feel it as a stressful life. And when we talk about the family issues, means there are a lot you can connect to your family issues, or whatever stress you are facing in your family. All that whenever it increases up to the chronic stage, then all the different types of disorders, what I'll be telling in the later slide. So you can correlate with that, what are the symptoms you will be facing with the stress. And the trending one, what everybody is facing now in the entire world, that is a COVID-19 pandemic situation. So here the stress is different for different persons. So there are many people, they have lost job, they could not go for the job properly. So in India, we had 2 months of lockdown period, so people could not work properly. And if you consider St. Aloysius College, so now they could not finish the academic year, and they are not able to start the new academic year. So that is a kind of stress to the management, and also the stress to the departmental level. So, and also students, those who are doing the final semester, they also could not finish their courses yet. So they must be in the very stressful life, like what can be done later. So unless they finish their exams, they won't be getting the degree. Unless they won't get the degree, so it is very difficult situation for them to get a job. So all these are the different kinds of stress. Just few examples I'll be giving, but you can correlate the kind of stress what you are facing in your day-to-day life. So there are no specific definition for the stress, but I have just collected one line which will give very much clear information about the stress. It's a normal reaction the body has when changes occurs. It can respond to these changes either physically, mentally, or emotionally. And the associated symptoms what we are facing whenever the person is under stress, like it can be cognitive symptoms, emotional symptoms, physical symptoms, or behavioral symptoms. Cognitive symptoms, like the person will be feeling memory loss, inability to concentrate on one kind of work, or they cannot judge properly whatever things they are doing. And always they'll be thinking something negative, and the person will be anxious and keep on worrying about one or different aspects. And emotional symptoms, like it can be depression, anxiety, moodiness, or feeling isolated, or loneliness. And the physical symptoms, like the people will be feeling headaches, diarrhea, nausea, chest pain, and loss of sex drive, and frequently getting infections like cold and flu. And also you can feel the behavioral changes, like whenever the person is under stress, some people they eat more, or some people they eat less. Some people they cannot sleep properly, or in between the sleep they'll be waking up, and uh, they'll always keep themselves isolated. And some people, even they undergo addictions of alcohol, cigarettes, drugs. And you might have felt during the stress, some people will be having nail biting, or shaking their legs or hands. So such kind of behavioral changes is a very common symptom of the stress. And also it depends on the what kind of stress you are facing, and what the level of stress you are facing. So all these symptoms, it matters, depends on that. So what is going on in the brain and in the nervous system during the stress? So in order to know that, so we need to know about the nervous system first. So in the nervous system, there is mainly you can categorize into two. That is a peripheral nervous system and central nervous system. In the central nervous system, the two different parts are involved. That is the brain and spinal cord. And in the peripheral nervous system, again, it can be classified into two different types. That is autonomic peripheral nervous system and somatic peripheral nervous system. In somatic, there are two different types of neurons which are involved. That is sensory neurons and the motor neurons. So sensory neurons are the neurons which collects the information from your sense organs, and it passes the information from the sensor through the sense organs to the spinal cord, or finally into the brain. And from the brain again, the information will be coming back into the muscle, into the skeletal muscle. That is through the motor neuron. So that is the two different categories what you can see under the somatic nervous system. And in the autonomic nervous system, that is like your the control of your body parts, or the glands or the organs, what you have. So you don't have to do anything. So it works by itself. So that is nothing but the nervous system which is controlling these organs by itself. Again, you can categorize into two different types here. That is sympathetic and parasympathetic peripheral nervous system. So sympathetic is nothing but when you're under stress, that is arousing, and when you're coming down from the stress or calming down, that mainly acts because of the parasympathetic nervous system. So if you see the difference between this sympathetic and parasympathetic nervous system, so there are different aspects which takes place during when the sympathetic and parasympathetic nervous system gets activated. So, for example, giving a speech. Suppose I'm talking now. I'm giving a talk, or giving a speech, or any person, those who are giving speech. So, are they under stress or are they under anxiety? So, what will be the stress level? So, it all depends. So, like, if I tell that when I'm giving presentation, so do I have the stress? So do I have the stress means the question comes, so why exactly I get stressed? The reasons are different. As I mentioned here, some people, they will be having stress whenever they face the audience. So if the
Hello, hello, Madhu, Dr.
yes,
Madhu.
yes,
Uh, can you just pause for a minute, because some participants are still waiting to enter the webinar. They're not able to enter. There is some technical problems. And can you just wait for 5 minutes and then continue?
okay, sure,
Yeah, yeah. Just. I'll get back to you in 5 minutes.
okay. So there are more participants are joining now, so we can wait for some more time, then we can start again. So those who are joining now, you can just turn off your audio and video.
Uh, Dr. Madhu,
Yes.
I think you can go ahead with your presentation. We have sent the joining link again to some of the participants who couldn't join.
Okay.
I think you can, yeah, you can continue.
Okay.
Sorry for the the interruption.
Okay. No problem. Okay. So those who have joined now, can you please turn off your audio so that there won't be any disturbance? Okay. Thank you. So I was talking about the sympathetic and parasympathetic nervous system. So, with the example of giving a speech. So, whenever the person is giving speech, what exactly happens, or before the presentation? So, what exactly happens in the nervous system, and what are the changes which occurs in the during in the body during the presentation or before the presentation or before the speech. So that's just one example what I'm trying to give here, but you can correlate this to any kind of the mental stress what we'll be facing. So the stress will be obviously whenever we face the audience. So if there is a huge number of audience, so the stress level of the presenter will be obviously it will be more. Why? Because um, so the one thing is the people whom you're facing, if they are not familiar to you, of course the stress level will be more to the presenter. And whenever during my presentation, so I'll be having a question like whether the participants or whether the audience will be understanding whatever I'm trying to say. So that will be keep on coming in my mind. So that also increases the stress level. And uh, another thing is expecting the questions or doubts like at the end of my presentation. So whether the audience are getting, are they understanding or are they getting a doubt? So that is another kind of stress what the presenter or the person who is giving speech will be facing. And if there is any grading like a student presentation, so whenever the students are presenting in front of the teachers or in front of the professors, so that time again the stress level of the students will be more. Why? Because uh, along with their presentation, they also having in their mind that somebody is grading them. So that is again the stress level during that time will be more. So what happens in the nervous system, that is a sympathetic nervous system, it will keep you alert, it will keep you energetic and ready during the stress condition. And so what are the changes which happens in the body during the sympathetic nervous system when it is active? The eye pupils will be dilated, and heart rate or the heartbeat will be increasing, and the digestion will be inhibited. So maybe you might have faced this kind of the symptoms whenever you'll be feeling some kind of stress, or maybe just before entering the exam. So you won't feel like hunger during that condition, and the heartbeat obviously it will be more. And during that time, the biochemically there's some kind of changes which happens. That is, the glucose level increases. That is, more of glucose will be released from the liver, and there will be a stimulation of the adrenal gland, which because of that there will be secretion of the two different hormones, that is epinephrine and norepinephrine. And during stress level, or whenever the sympathetic nervous system is active, the bladders will be relaxed, and there will be the sex organs gets stimulated. So these are the different changes which occurs whenever the sympathetic nervous system is active. And what happens after the speech? If I go back to the same example, what happens after the speech, or after when I'm calming down? So that is mainly where the parasympathetic nervous system is getting activated. So that time it will calm you down, and it conserves the energy, and it decreases the heartbeat, and it stimulates the digestion. The bladder will be it contracts the bladder, and there will be blood flow taking place into the sex organs. So these are the in the bodily changes, or the biochemical level changes, and also the glucose level will be reduced during that time. So these are some changes which happens during stress and after the stress. So if I go back to the same example again, the person when is giving speech. So if the person is experienced, how does it matter? So experience makes it better or not. So what happens is, if you are very experienced facing the audience, obviously your stress level will be less. So so now I am presenting in front of you all, so I don't have to face the audience exactly. So obviously the stress level will be less here. And if you give the similar kind of talk again and again, suppose the same slides I'll be presenting again and again in a different platform. So that time the stress level will be, obviously it will be less. And if nobody is grading you, then again the stress level will be less. So that's how the experience will change the level of stress in the person who is presenting first time, or the first person who is presented so many, or having a lot of experience. So that is a kind of a mental stress what you will be facing. There are some kind of a physical stress, how the nervous system is responding to that. So one kind of physical stress, I just try to give an example here. That is, if you're touching a flame, so what will be your response when you are touching a flame? So immediately you will remove your hand. Why? Because you will feel heat. So that is mainly because of the two neurons, that is the sensory neurons and motor neurons. So what happens when you touch a flame? The sensory neurons, which is there on the from the skin through the muscles. So the sensory neurons will give the signal, and it passes the signal to the spinal cord, and from the spinal cord the information will be reached to the brain, and from the brain again the information comes back through the spinal cord, and through the motor neurons it will be reaching to the skeletal muscles. So you'll be removing your hand. So it's a very quick process taking place. As soon as you touch the flame, you'll be removing your hand. So all these reactions will be taking place in a fraction of seconds. So it is a best example for a physical kind of stress. I can give one more example. Like if you're driving a car, you'll be going at a speed of 40 or 50, and suddenly you'll see something in between the road. So what exactly you will do at that time? You'll press the brake, right? So nobody has to tell you to press the brake, but it is in your unconscious mind it happens. So you'll be pressing the brake. That is nothing but you'll be your sense organs like eyes. You'll be seeing something in front of your car, and the information goes to your brain, and from the brain again the information comes back to the through the motor neurons to the skeletal muscles of your leg, and you'll be pressing the brake. So that's what happens whenever there is a physical kind of stress. So what about the emotional stress? So So mental stress, physical stress, emotional stress, all these are different aspects. So emotional stress, usually these are going to become a chronic kind of stress. I'll be giving the same examples what I mentioned earlier. If a person is losing the job, or if the person is failing in the exams, or death in the family, or family issues, divorce. Family issues can be anything. So you know what are the different types of issues what you face in the family, or chronic health issues. Some people, they will be facing some kind of health issues, like either diabetes, or the serious issues like cancer. So for a longer duration of time, so that can also induce the stress. So these kind of emotional stress, if a person is facing for a very long duration of time, that time either the acute stress or a short period stress can turn into a chronic stress, and those chronic stress are responsible for the different types of neurological disorders. So in order to know about that, what exactly happens during the emotional stress, so we should know something about the brain anatomy. So I'm showing here two different pictures of the cross section of the brain, and which is showing different parts of the brain. The cerebral cortex or neocortex, the top portion, and the other parts of the brain, like basal ganglia, thalamus, hippocampus, hypothalamus, amygdala, locus coeruleus, spinal cord, cerebellum, and this is the pituitary gland. So you can see even this picture, the pituitary gland, so which are not labeled here. So what happens during the emotional stress or fear or bad memories? It can be traumatic, like you'll be facing one-time experience, or you'll be keep on thinking about the same thing again and again. So that also during that time also the similar kind of reactions will be taking place in the brain. So whenever you are having emotional stress, you'll be encountering the emotional stress, you will be encountering the fear. So during that time, the brain part, that is amygdala. So this is the green portion what I'm showing in the picture here, left side picture. So that amygdala gets activated. So whenever the amygdala is getting activated, it can again activate the two different portions of the brain. It can activate the locus coeruleus, and it can also activate the hypothalamus. So whenever the hypothalamus is getting activated, the information passes through the HPA axis, that is hypothalamus, pituitary, and adrenal axis. So the information will be going in this way. That is a corticosteroid releasing factor will be released from the hypothalamus, and that factor, the CRF factor, will be acting on the pituitary gland, and in result of that, the pituitary gland gets activated, and that will be releasing another hormone called as adrenocorticotropic hormone. So this adrenocorticotropic hormone released will be acting. It comes to the blood, and it can act. It can act on the adrenal cortex, and the activated adrenal cortex will be releasing another hormone called as cortisol. So, so all this will be coming into the bloodstream, and same time the activated hypothalamus, which can also act on the which can act on the locus coeruleus, and it activates the locus coeruleus, and that will be giving the information through the sympathetic nervous system. That is mainly, it activates the sympathetic nervous system, as I mentioned in the earlier slide. So the sympathetic nervous system, when it gets activated, it can give the impulse, neuronal impulse, and it activates the neuron impulse, and it activates the smooth muscles and glands, and in response to that, you'll be showing some kind of response that is called as a fight and flight response. It's nothing but how your body is responding to the stress. So that is called as fight and flight response. And meantime, the activated sympathetic nervous system, which can also act on the adrenal medulla. The adrenal medulla, uh, if you are not familiar with this, I can show in this picture again. This is the adrenal gland, and exactly in the adrenal gland, the adrenal medulla region will be secreting two different types of hormones, that is epinephrine and norepinephrine. These are the two more hormones which will be secreted, and it will come into the bloodstream. So, and once these hormones are coming into the bloodstream, it will be showing some kind of response to the stress. So, so in this slide, I mentioned whenever there is a emotional stress, fear, or bad memories, it will activate the amygdala. So, how exactly it activates the amygdala? So, here I'll be giving some information on that. I'll be giving again the similar examples of the emotional stress, the chronic stress, or fear, observing a road accident or death, or people crying in a sad situation, hearing a louder sound, feeling the electric shock, feeling the pain. So these are the some kind of either the fear or the emotional stress so what you'll be facing. So during that time, mainly the sense organs will be facing that, and the sense organs will give the information to the brain through the sensory neurons. And in the brain, mainly the sensory cortex and the thalamus. So these are the regions of the brain will be storing the such kind of information initially, and from the cortex and the thalamus, the information will be given into the deep midbrain, and in the midbrain, mainly the emotional for the emotional stress, that is mainly the amygdala region will be activated. So when we talk about the amygdala region, so in the amygdala, there are mainly 13 different subdivisions are there, or subregions. So I won't be mentioning all the different subregions of the amygdala, but mainly you can see three different subregions here. That is central amygdala, lateral amygdala, and basal amygdala. So these are the three different regions of the amygdala. So whenever the information which is coming from the sensory organs through the sensory neurons, and when it reaches to the sensory cortex and thalamus, the information will be input into the amygdala. Initially, the lateral amygdala will be responding to that. It collects the information from the cortex and thalamus, and it starts processing the information. Information is nothing but the connections between the neurons. So when it starts processing the neurons, so mainly it will try to understand the lateral amygdala will try to understand what kind of stress it is, whether it is a or what kind of stimuli it is. Is it uh, the conditioned stimuli, or is it an unconditioned stimuli? So the unconditioned stimuli means something if you're facing first time, or the fear you're facing first time, or the stress level which you're facing first time. So that is called as a unconditioned stimuli. And a conditioned stimuli is like you already have such kind of experience earlier, or you have faced such kind of traumatic condition earlier, and you'll be encountering such kind of condition again. So that is called as conditioned stimuli, or you'll be thinking about that. So whatever you have faced in the earlier life, you'll be thinking about that again. So that is also called as a conditioned stimuli. So such kind of stimuli, it will be the lateral amygdala region. It will be processing the such kind of stimuli. It will collect the information together, like is it first time, or is it the such kind of memories are already stored. So the memories can be stored in the amygdala. It can also be stored in the hippocampus. Altogether, the information will be collected, and then the lateral amygdala will be giving the information into the basal amygdala. So in the basal amygdala, again, the information will pass through the interneurons, one kind of interneurons are GABAergic interneurons. So through the interneurons, the information will be the basal amygdala role is only processing, and further it is transferring the information into the central amygdala. So from the central amygdala, the information will be passed down into the other regions, or the fear will be passed down into the other regions. So as I mentioned in the earlier slide here, when the amygdala gets activated, it can give the information, it can pass the information into the hypothalamus or into the locus coeruleus, and how the information will be flowing, and finally will be responding to the stress. So that's what happens during the amygdala activation. So these are some research articles which is very much correlating to that, what exactly happens in the amygdala. And whenever you feel a stress, or if you have felt a stress for one time, two times, or several times, similar kind of stress, so it becomes a chronic level, and the chronic stress may lead into chronic level of stress may lead into a neurological disorder. So these are some two papers which are published in the Biological Psychiatry Journal. And this the first paper, that is chronic stress causes amygdala hyperexcitability in the rodent model. They have studied this. So what they are trying to say here is, whenever the information passes from one neuron to another neuron, there will be action potential taking place. And during action potential, so those who are not aware of this action potential, means it is the information or the impulse will be coming from one neuron to another neuron. There will be a lot of ionic changes which is taking place in the connection between the two neurons, that is called as synapse. And in the synapse, mainly the potassium channels, that is the calcium activated potassium channels, which are altered, which gets altered during the post-traumatic stress. So both the papers which are done in the post-traumatic stress disorder, so those potassium channels are getting altered. So, and they say that that is one of the reasons for the stress is continuing into a chronic stage, and then it is then it forms as a neurological disorder, that is a PTSD, which is called as a post-traumatic stress disorder. That is one aspect. And in another paper, this in the same journal which was published, and they are trying to say here is in the amygdala, especially the serotonin transporters are getting, or it is getting reduced. So that is mainly, if you see this particular picture, serotonin is which is a neurotransmitter which is released by the neurons, and these are called as happiness neurons. So whenever you feel very happy, that at that time the serotonin level will be more. So once the serotonins are released in the synapse from one neuron, it will go to the next neuron. That is nothing but it is passing the impulse into the neighboring neurons. So this serotonin has to be captured by the serotonin receptors, and it will be transported through the serotonin transporter. So in this particular paper, they say that during the stress, these transporters are getting altered. Because of that, the serotonin impulse cannot go into the, so it will go into the, it cannot go into the next neuron. And meantime, also there are some transporters which is taking up the serotonin back into the same neurons. So that is called as a selective reuptake of the serotonin. So there are some kind of antidepressant drugs are there, which is mainly blocking these kind of transporters. That is whatever the serotonin released, the re-entry of that serotonin into the same neurons, that can be inhibited by such kind of inhibitors. Those are called as SSRIs, selective serotonin reuptake inhibitors. So these are the two examples I have mentioned here why, because so what exactly happens in the amygdala whenever you feel stressed, and how the repeated such kind of stress, how it can lead into a chronic stage. So these are the two best examples. And there are several studies which is in relation with this are already reported. So I'll be giving some more information on the hormones which is released during the stress. One of the main hormone is cortisol, which is released by the adrenal cortex, and it is increased whenever there is a increased amount of the cortisol. It increases the blood sugar level and it suppresses the immune system. And another hormone, which is catecholamines, as I mentioned earlier, the epinephrine and the norepinephrine are the catecholamines. So whenever the amount of these are released by the adrenal medulla, and it can increase the heart rate, it can increase the blood pressure, blood glucose level. Another hormone is vasopressin, which is mainly responsible for inducing the ACTH, adrenocorticotropic hormone, and release of the catecholamines. Gonadotropin is one more hormone. Usually what happens to the gonadotropin is the secretion or the release of the gonadotropin will be reduced. It will be secreted from the pituitary gland, but during stress, the amount of this amount of these hormones will be reduced. So maybe some people, the ladies or the women, they might have felt this. Whenever the people are under stress, their menstrual cycle gets altered, or the monthly periods, the dates will be getting altered. So that so this is one of the reason for that. Whenever you feel stress, the gonadotropin level will be reduced. One more hormone which are not directly uh, from the brain which is getting affected, but the thyroid hormone, that is mainly because of the during stress. What happens is the pituitary gland, it will be releasing a less amount of the thyroid stimulating hormone TSH, and in result of that, whenever there is a less amount of TSH, it cannot act on the thyroid gland, and whenever the thyroid gland is not activated, so it will be releasing less amount of the thyroid hormones like T3 and T4 hormones. So ultimately, it will affect the metabolic process of the carbohydrates, lipids, or the fats or proteins. Metabolic process gets altered. So you might have heard about this. The people who are under stress, either they are gaining weight or they are losing weight. That is mainly because of the thyroid problem what they are facing. And one more hormone which I mentioned here is insulin. So insulin level will be decreased. That is the result of rise in the other hormones like epinephrine and cortisol. So whenever there is a decrease of the insulin, uh, the blood glucose level increases. Blood glucose level increase means it will induce the diabetes or associated problems like obesity or hypertension. Um, so that is an associated problem what you'll be facing. So, and what happens in the brain cells exactly? So whatever I mentioned is something about the hormone changes which is taking place, and in the nervous system, what exactly happens. And in the brain, especially if you see, brain is having the different types of cells, such as the major populated cells are neurons, microglia, oligodendrocytes, astrocytes. These are the major populated cells in the brain. And these are the cells which is getting affected during the stress conditions. So I'm getting some kind of noise here. Somebody has turned on their audio. Can you please turn off your audio? So whenever there is a HPA, that is a HPA axis hyperactivity will be there. HPA means that is hypothalamus, pituitary, adrenal, the signaling, the impulse passing through that. So whenever HPA hyperactivity is there, there will be increased glucocorticoids and cortisol release. And this glucocorticoid or cortisol release will make the mitochondria inside these cells, especially in the neurons, will make more active, and in result of that, and also there will be increased amount of NADPH oxidase enzyme, and because of that, in the mitochondria, especially the oxidative phosphorylation and energy production gets affected. Because of that, there will be a lot of reactive oxygen species or the oxygen radical production taking place. So this is a kind of chain reaction. Ultimately, the other reactions which is taking place to the lipids or proteins, the oxidation of the lipids and proteins will be taking place, and there will be increased pro-inflammatory cytokines release, especially from the microglial cells, that is TNF alpha, IL-1 beta, IL-6. These proteins level will be increased. So overall, there will be oxidative stress and neuroinflammation taking place in the brain. And in the brain, because of that, there will be neurodegeneration. Neurodegeneration means it is nothing but death of the neurons. And whenever there is a death of neurons, you can the death of neuron can also take place because of the synaptic loss or synaptic damage or microglial activation. The microglia, usually the microglia cells, either it will be in the resting state or in the activated state. So whenever it goes to the activated state, you can see two different types of microglia, that is M1 and M2 microglia. M1 microglia is called as bad microglia, M2 microglia is called as good microglia. So M1 microglia, usually it will be releasing more of pro-inflammatory cytokines like IL-1 beta, TNF alpha, IL-6 or nitric oxide synthase enzyme, and M2 will be releasing more of anti-inflammatory proteins like IL-10, IL-4, or TGF beta. So whenever there is a synaptic loss or microglial activation, so the activated microglia, again, it acts on the neurons, and it can act on the dendrites, it can act on the synapse. Ultimately, it is damaging the neurons. So there will be neurodegeneration. So if there is a neurodegeneration, there will be memory loss, and cognitive impairment will be taking place. So whatever the symptoms, as I mentioned earlier, partially these kind of symptoms are also because of the such kind of changes which happens in the brain. So from the beginning, I was saying that all these kind of the stress, mild stress, or when it becomes a chronic stress, it can reach into a stage called as a neurological disorder. So I have listed out some of the neurological disorders uh, uh, which is because of the stress. So one among that is a post-traumatic stress disorder. So in the post-traumatic stress disorder, you can see all these kind of symptoms, whatever I have listed here, mainly because of some kind of traumatic events, what you have faced in your lifetime, the unwanted distressing memories, the recurrent of such kind of memories, or a flashback of the such kind of events what has been taken place earlier, or bad dreams, nightmares, or the emotional distress or physical reactions. All you'll be keep on thinking about such kind of traumatic events. And the other kind of symptoms like avoidance symptoms. So you'll be trying to avoid to face such kind of events again. So you'll be trying to avoid thinking about such kind of traumatic events, or you'll try to avoid people or places who is making you to think about such kind of events again and again. So those are some kind of symptoms what you can see in the PTSD. Uh, and also the negative changes. So always you will be thinking negative about yourself or about the others, your surroundings. You'll be having hopelessness and memory problems, difficulties maintaining the relationship with your close ones, and always you feel detached from your friend circle or with the family members, or difficulties to have the positive emotions. So these are the some kind of the the symptoms what is related to the mood whenever the person is suffering with the PTSD. And also some kind of reactions will be showing in response of that. The people will be frightened, and they always they'll be being on a guard of danger, and they'll be having the feeling of self-destructive behavior, trouble in sleeping, trouble in concentrating, irritability, or feeling guilty or shame. So these are the emotional reactions of what usually the people, those who are suffering with this disorder, will be showing these kind of symptoms. Another disorder is a depression. Uh, the many of the symptoms which is very much similar in all these kind of disorders. The person will be feeling empty mood, anxious, hopelessness, and there won't be any interest in the activities, and decrease the energy. Always the people feel fatigue, and there will be problem in concentrating for one kind of aspect, and the people will be getting proper sleep, or the disturbance in the sleep, or thoughts of getting the death or suicide attempts, or restlessness, irritability, or constant headaches. So these are the some kind of symptoms what usually you can see the person who is under depression. Anxiety is another thing, where you'll always feel restlessness, and you'll feel like you're on the edge, and you cannot control on your worries. There will be a lot of irritability. The irritation will be increased. Irritation will be there, and you cannot concentrate on one aspect. So you'll be keep on thinking about the different aspects. You can't focus really on one aspect. And of course, the sleeping disturbance is also one of the symptoms of the anxiety. Migraine is another thing. Um, so during migraine, which is a very severe headache, and along with the headache, you'll also feel some other type of symptoms like nausea, vomiting, difficulty in speaking, numbness, tingling, and sensitivity to the light and sound. So these are the different symptoms which is associated with the migraine. So those are all, you can call it as a mild neurological disorders. Of course, the person who is facing that will be having the serious problems, but it can also lead into some kind of the actual disease condition. So one among that is a Parkinson's disease. So all these, the information whatever I'm giving, these are all based on the research findings. So there are several research articles which says that the chronic stress can lead into Parkinson's disease. In the Parkinson's disease, mainly it is affecting the motor neurons, and it is affecting the movement. Um, there are some kind of symptoms what you can see: tremor, where people will be keep on shaking their hands or limbs, or sometimes they cannot move properly. There will be slow movement, and their muscles will be very rigid, and there will be a lot of muscle pain will be there, and their body posture or balance won't be there properly for the patients, those who are suffering with the Parkinson's disease. And loss of automatic movements, like blinking your eyes, or you're swinging your hands while walking, or smiling. So such kind of the automatic movements what is taking place that gets affected in the Parkinson's disease. And also the speech changes. So the person, those who are suffering, they cannot talk properly, and their voice will be very slow. So these are the some symptoms. And here I have cited one paper which is published in 2016 in the Experimental Neurology Journal. And this was done in the animal model. So what they said in this paper is the chronic mild stress, which can the person who is suffering with the or in the early stage of the Parkinson's disease, if they are facing kind of chronic stress, the progression of this Parkinson's disease can be it gets enhanced. So mainly they have seen a protein called as alpha synuclein. So this is the one protein which is responsible for the Parkinson's disease, which gets accumulated in the brain. Schizophrenia is another disorder, which is a very serious mental disorder. The problems or the symptoms which is associated with that is delusions, where you'll be having a false beliefs that are not based on the reality. Like in reality, there won't be anything, but you'll be thinking about that something bad, or hallucinations, like you feel like something has come in front of you, or you'll feel some kind of sound. So that kind of the behavioral changes or hallucinations will be very common in the schizophrenia. And disorganized thinking. So the person who is suffering with this disorder, they can't think properly on one particular aspect. The thinking level will be keep on changing to the multiple aspects at a time. So that is called as disorganized thinking, and extremely disorganized or abnormal motor behavior, and also the negative symptoms, lack of ability to function, or their day-to-day life will be very much difficult whenever the person is under facing schizophrenia. One more disease is Alzheimer's disease. So, which is not very much common in the stress, but also there are some research findings which says that the chronic stress can lead into Alzheimer's disease. Um, One of the main reason here in Alzheimer's disease is the accumulation of the proteins like amyloid beta protein and tau proteins. Usually amyloid beta proteins which gets accumulated uh, in between the cells, that is the extracellular space, and tau proteins which gets accumulated inside the neurons. So this is one of the reason for Alzheimer's disease, and in response to that, there will be a lot of the symptoms what you can see, like memory loss, depression, mood swing, irritability, aggressiveness, and difficulty in making judgments. So these are the some symptoms which is associated with the Alzheimer's disease. So here are two papers which I'm showing here, which are the one paper which is published in the Science journal. So in this particular journal, what they said is the sleep cycle is regulating the protein, that is tau protein, which is responsible for the amyloid, which is responsible for the one of the reason for Alzheimer's disease. So whenever there is a dysregulation or altered sleep, so the level of these proteins gets altered. And the similar kind of finding for amyloid beta, another paper which was published in PNAS. So in this paper, what they were trying to say is, if you skip one night sleep, so the amount of amyloid beta in the brain, so usually this amyloid beta protein production which takes place in the brain, but whenever there is a mutated kind of amyloid beta or aggregation of this amyloid beta takes place in the brain, which leads into Alzheimer's disease. Uh, but so what happens in the whenever there is a stress, so or whenever there is a alteration in the sleep. So if you, this particular paper says is if you skip a one night sleep, so the amount of the Alzheimer's protein or amount of this amyloid protein level will be almost four-fold increase of this Alzheimer's related protein, that is amyloid protein, takes place, and it gets accumulated. Think about that. So if you're not getting a proper sleep for several days or several months, or some people are suffering with sleep problems, they cannot get the proper sleep. So during that time, the amount of or if you alter your sleeping pattern for one day to another day, the amount of this protein may it can get increased. Why exactly? Because so what happens during the sleep is there will be a cerebral fluid flow will be there in the brain. So it is like a washing the brain. So washing the brain means all the unwanted things, what is unwanted proteins, what is producing. So those will be removed from the brain, which is mainly happens during the sleep. And if your sleep gets altered, so the accumulation of these proteins can enhance. That's what this particular paper is trying to say. And some more information I can give here, how you can reduce the stress or relieve the stress. So you might have heard about other things also, or maybe some people you already know how to reduce the stress. I mean, reducing the stress means not really the solution for your problems or the stress, but how you can reduce the actual stress or the actual biochemical changes, what is happening in the brain, it can be controlled. So the best thing is exercise, walking, dancing, yoga. So what happens during that time? Again, all this information what I'm giving is all based on the research findings. So it releases endorphins. So these endorphins are the natural painkillers which improves the mood, and also it can reduce the epinephrine and cortisols, which can also improve the sleep quality. And along with your regular food, if you have the supplements like just few examples I'm giving, but there are a lot. The green tea, which is having the polyphenols, antioxidant, which can reduce the stress by increasing the serotonin level. Serotonin, which is also called as the hormone for the neurotransmitter for the happiness. Omega-3 fatty acids, which can reduce the pro-inflammatory cytokines level, and citrus fruits can lower the cortisol, it can lower the blood pressure. Greeny leafy vegetables, it can increase the dopamine, and it can decrease the cortisol level. Turmeric, which can stimulate the secretion of serotonin and dopamine levels. And also the next point what I mentioned here also, which is reported in the scientific journals, like if you spend more of time with the family members or with the friends, or if you spend time by laughing or smiling or being happy, so that time the oxytocin release will be more. So oxytocin is a oxytocin, which is produced in the hypothalamus and released by the pituitary. So, which is a natural stress reliever, and it reduces the cortisol. And also, love, cuddle, kiss, or having sex with your partners, which can also increase the oxytocin level. Ultimately, it can uh, reduce the overall stress level. And some information here on the pharmacological approaches, how you can reduce the stress. So these are the different types of the drugs. So all these medications are always good to take with the consulting the doctor. So these are the some commonly used medications for mainly for the depression and anxiety. The drugs which comes under the category of benzodiazepine, and the drugs which are serotonin receptor hydroxytryptophan, that is serotonin receptor agonist, and cyclooxygenase inhibitors, the two examples I mentioned here, and the supplements like antioxidants, beta carotene, vitamin C, vitamin E. So these can also reduce the stress, and tricyclic antidepressant drugs. So these are some medications which can reduce the stress level, or whatever the biochemical level changes which happens during the stress, that can be reduced. So that's all from this presentation. So this is a cartoon. What I'm showing here, it's a very good cartoon which I got from some of my friend was posted in their WhatsApp status. You become what you feed to your mind, like whatever you think. If you think bad things, if you have negativity, so you'll be having such kind of shit, and the brain will be facing such kind of bad things, and it will become sick. And if you always have a disciplined life and positivity or good dreams or a lot of good food habits, that can keep your brain healthy. So thank you very much for your attention. And if you have, I can see some of the questions which is posted here. Maybe I can try to answer some. Is it okay to answer, Dr. Yogesh?
Yeah. You can go ahead. There are some interesting questions which have been put up in the chat.
Okay.
Yeah, you can answer a few of them.
So what is the impact of getting stimulated anger on the brain? So anger is again how you are responding to the things. So anger again, it will make all the biochemical changes what I explained in my presentation. So you can correlate the anger condition to that. There will be a lot of biochemical changes which happens in the hypothalamus and in the pituitary gland, and in response to that. Uh, see, the biochemical, whenever changes happens, whenever you're in the anger state, the heart rate increases, you'll be feeling more of sweat. So these are the bodily changes which can take place during the anger or stimulated anger. Why do you have dreams? Is it related to the stress? So dream is again, it's a very big topic if you're talking on that. So dream comes mainly in the different stage of the sleep. So in the sleep cycle, there are mainly two different stages, that is REM sleep and non-REM sleep, that is REM and NREM. You can read on that. So in the REM and non-REM sleep, REM means it is a rapid eye movement. So whenever the person is under REM sleep, there will be a lot of dreams you will be getting. So your eye movement will be fast, and your heart rate will be fast, and your body temperature will be more. So during that time you will be getting a lot of dreams. Even in the non-REM state of the sleep also you will be getting dreams. But most of the dreams what you are getting in the REM sleep. So the REM sleep is like during REM sleep, what happens is there are different waves in the brain, which are called as delta waves, beta waves, theta waves. So these are like the waves between the neurons. The signal passes from one neuron to another neurons like a wave. So during that wave, you will be getting different kind of dreams, and how the waves goes in which direction. Based on that, you'll be getting the different kinds of dreams. Sometimes what happens is the different aspects what you have faced in your day-to-day life, and everything gets connected in the dream. So that is why, because in which direction the signal goes, or which direction the neuronal impulse goes, that way you'll be getting the different types of the dreams. Let me read some more questions. How effective is cognitive behavior therapy in treating PTSD? So PTSD, of course, the cognitive behavior therapy is one of the commonly the psychiatry people, they are using this in order to treat the because PTSD is like, it is not a very severe kind of a disorder. They'll be leading their routine life, but they cannot be properly concentrating on the things what they are doing in their day-to-day life. So some kind of briefing to such kind of persons, like cognitive therapy, so that can improve their the stress levels. So what is the reason behind sleep walking or sleep talking? So maybe I have no much information about this on the sleep talking and sleep walking. So basic difference between fear and anxiety. There is no much difference between fear and anxiety. That is, fear is like the common word, uh, which is the response to the anxiety what you'll be feeling. So when amygdala is associated with consolidating memory and stress, having a great impact on amygdala. How far could tongue exercise help in this? No idea about that. So women appear to more prone to stress than men. Can you justify it? Uh, of course, the main reasons are the hormonal variations. So during the menstrual cycle, there will be a lot of variations taking place in the hormone and the secretion from the pituitary and from the hypothalamus. That is one of the main reason, especially in the women, what you can see the differences. So how is diabetes related to stress? So in one slide, I gave a little information on that. So the stress-induced diabetes, that is during stress, so what happens is the increased epinephrine and cortisol hormones. So these are affecting on the pancreatic cells, and in result of that, there will be less secretion of the insulin. And if there is a less amount of the insulin, it cannot act on the blood glucose level. The blood glucose level will be increased during that time. So that's what responsible for the diabetes. Okay, so I can see only that many questions.
Yeah. Uh, yeah, I can make out that there are a lot of questions, and also you have a very good feedback from a lot of participants. So thank you, Dr. Madhu. And for the participants, I have provided a link in the chat box. Please fill in to avail the certificates. I request the head of the department, Dr. Swarna Lata, to conclude the session.
Okay, thank you, Dr. Yogesh. Okay, it's my pleasure to propose the oath of thanks. First of all, very sorry for the participants regarding the technical issues which was there. So we had to stop in the middle and then we had to continue. Later, I think we could resolve it. The live streaming video YouTube link will be sent to the other participants and also to you. You can again view it if you are interested. So sorry for that. And for coming to oath of thanks, firstly, I would like to thank today's resource person, Dr. Madhu, for accepting this invite. And I think it's already late night there in US, and he's still there, and thank you, Dr. Madhu, for this session. It was really very informative, and you can see there in the chat box most of the feedbacks. The feedback is still coming up there. So thank you for that. And next, I would like to thank our principal and the management of the St. Aloysius College, Mangalore, for supporting to conduct this webinar. And then I would also thank all the participants who have showed such an active participation and in such a great number. Thank you to one and all. And lastly, I would like to thank my colleague, Dr. Yogesh, who was the great support to do all the arrangements with respect to this webinar. Thank you, sir. And thank you, one and all. Before you leave the portal, just one announcement. We are hosting our second webinar on July 24th at 3 p.m. And it's going to be given by Dr. Mahesh Gowda. He is the postdoctoral scientist at Helmholtz Zentrum Research Center, Germany. And the topic will be on pulmonary injury and fibrosis, an insight into model studies. So looking forward for your active participation for that also. The registration form link has been sent to your mail, so you can register to that. Thank you, one and all.